computer from home, where I always use. There we go. Tell me if that works okay.
That looks perfect. Thank you.
Okay. Let me make sure I can advance my slides here. Okay. Is that okay now? All right. So thank you so much for the invitation. I'm happy to be here today representing Latin 19 and a little bit talking about community-driven solutions for health equity. You mentioned already I'm a family doctor, and I am here not just as a physician, but or a professor at Duke, but someone who knows what it means to fight, just like you do, for dignity, for language access, for equity in health. I am originally from Argentina. I came to the US to train as a family doctor. And I just so you know, as I'm a Latina, as many in this call. But Latin 19 was founded. We started it in March 2020 at the beginning of the COVID-19 pandemic with the mission to elevate the Latinx voices, the voices of the Comunidad Latina, improve outcomes from the pandemic at that time via advocacy, data outreach, collaboration. And we started as volunteers. We are all volunteers with Latin 19 in an interdisciplinary nature. And it grew as a multi-sector group representing multiple disciplines, institutions, health systems from around the state, members of the Comunidad Latina, and allies of the community. The benefits of a multi-sectoral collaboration have been really dramatic to the point of really enhancing understanding of the community needs, leveraging resources and expertise from different sectors, creating a comprehensive approach to address root causes of inequities in health, and to really share and listen. As a Latina who has worked in health systems, who has been a rural doctor, I started my life in Illinois and then in Iowa. I was a rural doctor in Iowa before moving for 11 years, before moving to North Carolina. We're not that many members of the Comunidad Latina within health systems. And often we become tired into systems because we're trying to highlight inequities and issues that are happening. And what happened with this creation of a multi-sector group and this safe space of Wednesdays at noon, where we shared, starting in March of 2020, what was happening to the community and how the community was perceiving and what the community could do to mitigate the effects of the pandemic, was transformational in the sense of health systems really listening, being able to be there. And it wasn't just me, the Latina, always saying these things. It was the people directly hearing the community. So at this point, we continue to have more than 1,800 registered participants that come in and out of the Wednesday and noon meetings, and 2,300 people receive our newsletter. We want to work with those who want to be catalysts for social change, working tirelessly to break the cycle of health inequality that affects so many people in our communities. The grassroots approach that Latin 19 took fostered collaboration among community organizations, healthcare providers and systems, and policymakers, leading to better coordination of services and resource allocation. I am extremely thankful of so many of whom are in this call today, who show up on those Wednesdays to talk about issues, to learn, to talk and discuss. The coalition's work has had a lasting impact beyond the immediate COVID-19 response, serving as a model for addressing broader health disparities in Comunidades Latina, having a positive impact on health by reducing barriers to care, promoting health equity, and strengthening community engagement and policy and advocacy for Latinx populations in North Carolina. And this is a very important time to continue to do this. One of the things that we have tried to do is, as Latin emerged and as we were looking and listening to what was happening, is to try to quantify and research and publish so that decision makers can look at what we are doing, right? We are tackling challenges like lack of awareness, problems with data systems, problems with access to resources, problems with policy coordination, and then also coordinating, and we started working on quite a bit with AMESCAN, both formally and informally, and other sectors to support the resilience of our community. And I often think that resilience comes with being more informed and having the power of information to be able to advocate for changes that are going to support the community. But also it is demonstrated how grassroots responses can shape public health and policy outcomes as well. I'm going to show through my talk some of the publications that we have that have been published in different journals that have to do with policy and also medical literature. Some of the achievements has been to connect the community to health systems leaders. During the pandemic, we trained over 800 community health workers across North Carolina during the pandemic. We continue to work with community health workers in smaller groups, and unfortunately, funding is the biggest barrier. But we continue to work across North Carolina. We work in the creation of culturally tailored health literacy material in Spanish. We work on addressing misinformation with real-time accessible information, supporting equitable testing, vaccine distribution, and information services. We work directly with the Durham County Health Department with the Wool City Strong initiative. We have worked through research. Every area of research that we involve in, we try to always have a policy implication, what we're learning, how we do educate the public, and what kind of policy implications to have, and also that engagement and influence, being together here, listening to each other, the importance of collaboration. One of the big wins early on was that North Carolina's Latino residents were more vaccinated than the Hispanic population. No matter how much others may be wanting to spin the value of vaccines, save millions of lives, I want to be clear as a doctor, as somebody who has looked at the data, we need to continue to work on making sure our community has access to vaccines, to prevention. And this was one of the wins. If you remember, in 2020 and 2021, the Comunidad Latina was disproportionately affected by COVID-19, with a lot of young people even hospitalized and intubated. And when I say young, younger than other populations, people in their 60s were very ill and were members of nuestra comunidad, including the first child that died because of COVID was a Latina, a girl whose family was originally from Mexico. So we really need to think about the importance of prevention. And we are proud to have been a part of the great work that many of us in the state did to inform and get vaccinated. So some of the, when we talk about equity, health equity in action, what is the model? We want to do what is called community-led decision-making, working together from uniting health systems and community to make decisions. We have these regular listening sessions every Wednesday at noon, having different topics. We try to rotate topics. Sometimes, a couple of weeks ago, it was about measles. We want our community informed. Another topic a few more weeks ago was radon, and how the Comunidad Latina is disproportionately affected by radon toxicity. And sometimes it's listening about how do we get together to work with policies that are changing, that are affecting our community. And we all know that anything that happens, that political decisions affect health always, right? And so how do we work with this? Another part of the model is language justice and culturally humble approaches. I know what I know from my medical perspective, and the community is the expert on how they live our community, making sure that we're holding community as experts in their own lives and listening so that we can generate responses that are appropriate to each community, to each context. Doing data-informed advocacy and response, and I'll speak a little more about what's happening and what's missing in data, and then assess barriers and guide action across individual, community, and policy levels. The importance of centering community voices, I mentioned earlier. Empowerment happens through leadership development of our own community. We need to do bilingual and bicultural communication strategies. And when I say bicultural, and I'm also thinking and bidirectional, right? It's often in medicine, in health systems, we often get trained on how to understand whether the patient understands an issue, but we often don't get trained enough to go into the community to understand what the community's expertise is. And this is one of that bidirectionality of the knowledge. You know, what is my knowledge as a doctor, you know, the person in the white coat, what is my knowledge about what the community knows and how the community reacts during times of stress and illness, and all of that being this important value that we all need to learn together to co-create solutions, especially reaching for the solutions to reach those most impacted. And then making sure those community voices will influence intervention priorities. We also have highlighted, and I continue to highlight, the power of the community health workers or promotoras de salud. They are trusted messengers in the community. They help close gaps in care and access. We know that during the pandemic in particular, they supported public health response through education, trust building, and local presence. And if it was understood during the pandemic, this is one of my challenges to health systems worldwide. If it was understood during the pandemic, especially here in North Carolina, that community health workers really supported the response through education, trust building, and local presence, why aren't we continuously funding community health workers to continue the work of the multiple epidemics, including those epidemics of chronic illnesses that are affecting our communities? Community health workers have been integral to Latin 19 success in delivering community-based intervention, and we, as I'm sure you have, continued to try to write for grants that will support the fair pay of community health workers. We know they are, and we try to make sure that we collocate ourselves in that space for bridging health systems, languages, and cultures, helping people not be left behind in the pursuit of a healthier and more prosperous life. And this is so important today, right? This is so important right now. Many of those ideas that are shared at Latin 19 during the noon meetings evolve into research ideas to show the issues that matter to our Comunidad Latina. And sometimes I think our community is afraid of the word research. Are they researching on us? What we try to do is really bring those voices into research proposals that may do then surveys or focus groups or meetings in where we elaborate what we are learning and then get this published so that the publications reach the right people to be able to make the important political and equity decisions that are necessary. Some of the papers are written here, promoting Latinx health equity through community engaged policy and practice reforms in North Carolina, systemic racism affecting Latino populations. That paper showcased how Latinos don't think it's racism. But if you look at the definitions, a lot of persons from the Comunidad Latina have experienced racism from systems that they didn't recognize as such, but they're important to quantify. the importance of training community health workers as clinical research and healthcare system navigators. The issue of this more recent publication, no data, no problem, quantifying Latina eligibility gaps, is always often difficult to find which are the denominators. How many Latinos should be eligible for Medicaid but don't have it? And we really, how do we prepare decisions and policy changes if we don't really know what's the number that we should reach? And then others, and then often being really willing to be on camera, whatever is needed, to inform the community through different Univision, Telemundo, etc. One of the evolutions has been the project FLNC. This is a project that I work as in my role as the Health Equity Director in the Department of Family Medicine and Community Health. Thankful to the KB Reynolds Charitable Trust for the funds for this project to foster insurance enrollment among Latinos in North Carolina. That will be another separate talk, but that is a great effort that we're doing together with several partners within Duke and the partnership with many community-based organizations to train community health workers, and both in their communities and at the Latino Community Credit Union. Another project has been one on gun violence, public health, and youth. Again, another community academic partnership to prevent firearm violence in Durham, North Carolina. This project was led by Dr. Rosa Gonzalez Garda in the School of Nursing. We have a partnership with the Hispanic Federation in also increasing the number of people who are accessing the information about Medicaid and the information on the Líneas de Salud in North Carolina. And I think this is a collective win, right? And this is data from 2024. I'm sorry, I'm on call this week, and I didn't get a chance to go to look at today's data, but of the 50,000 Latinos that were expected to enroll in Medicaid expansion, already 73% had already enrolled back by April of last year. And now we are in this like arena movediza, this moving soil where we don't really know what's going to happen with Medicaid, with expansion, or although we know how negatively we'll be affected, but the importance of still continuing the work together, because one of the things that we learned was that there were many members of the Comunidad Latina who were eligible already before expansion and didn't know they were. And I think this particularly relative to children and young adults born in the United States that did not know they could be eligible. We, as I said before, partner with the Durham Department of Public Health with the Bold City Strong initiative in community promoter trainings. We must work to improve the integration of health promoters into health systems. If I think there's something that we need to continue, and for Latinas health promoters into health systems, giving them labor sustainability, stable financing. We need to ensure stable long-term funding for these community health workers, whether through government funding, private donations, or partnerships with nonprofits. Continue to do training and professional development. We work constantly on trying to figure out what are the new training needs that the community health workers need. We need to elevate the value of the work by health promoter at the institutional and community levels. We continue to train people to certify as community health promoters. In many of the colleges, the community colleges in North Carolina, but we need to advocate for labor insertion, for recognition of their work, and to insert in labor markets. We need to continue to foster collaboration between different organizations, institutions, and sectors to maximize the impact of the work of Promotoras de Salud, share resources and knowledge, and avoid duplication of efforts. And also conduct regular evaluations of the impact and effectiveness of the health promoter programs using data and evidence to identify areas of excellence, areas for improvement, and make adjustments as needed to ensure the long-term relevance and effectiveness. And long-term relevance will be if we are continuously adapting. But that also comes to us, you know, Latin 19, to all of our community-based organizations. Are we relevant? And we need to study whether we are or not, and if we are making the changes that are necessary. And then use technology effectively to improve the efficiency and quality. In this case, I was addressing community health workers, but I think it's all of our work, right? Through the use of mobile apps for case management, remote health education, outcomes tracking, etc. Some of the other issues that we work, the policy and system level impact I was sharing, Latin 19 help identify gaps in the pandemic response affecting comunidades Latinas, work across sectors to influence policy reforms. There has been a study finding highlighting how multi-sector coalitions embed community priorities in systemic solutions. Another study, as I mentioned earlier, explores systemic racism through the lens of Latino community health workers and community-based organization leaders. And the findings in general from a lot of this different work has revealed failures in policy inclusions and emphasized the value and lessons learned with the community health workers. We know that Latino communities in North Carolina have faced high uninsurance rates despite being eligible. And some of the barriers are limited language equity, limited provider concordance. When I talk about provider concordance, we are not enough Latinos, Latinas, Latine in healthcare. We are not enough. We need to continue to promote that our members of our community don't think that studying medicine, nursing, or our health careers are too much of a long-term goal or an impact. Yes, if you want to be a doctora, si usted quiere ser doctora, vamos a ayudarla. Pensemos cómo hacerlo. If you want to be a nurse, yes, think of yourself as being a nurse. Don't let others dissuade you from that, because we need more people who speak Spanish, who understand la comunidad latina, even if they don't speak Spanish, if they grew up in a Spanish background, in a Latino background, making sure that they are there, that they are learning those health careers. Data. Continue to work on data. Community-informed strategies include culturally tailored outreach, and we are in a moment where our community is afraid of entering their data in databases. And I understand why, because we are all afraid, you know, what is going to happen with my data? But how do we maintain a way of safety so people are not afraid of being quantified, so that we can create policies that approach and improve the health of our community. This was one of the studies that we just published, literally a couple of weeks ago. No data, no problem quantifying Latina individuals eligible but not enrolled in Medicaid or Affordable Care Act marketplace-based insurance in North Carolina. And what we learned is that because there's not enough data, we don't know what's the number. But I invite you to go to that. It's a free access journal. You can see it. We want you to partner. We want you to join our Wednesday conversations. And I know many of you who are in this meeting today have joined or join. Let's collaborate together on messaging campaigns, on research or data projects. Let's advocate with us for equitable health policies and funding, and connect with Latin 19 for upcoming events and initiatives. One of the things that is important for us, we are volunteer-led and volunteer-based, and the time of members has, except for a few people, but we have a lot of energy and a lot of interest in really trying to do this well. Some of the key strategies that have been recognized by research done by our teams have been that cultural and linguistic appropriate outreach is necessary, that we need to create more low barrier access to testing, to vaccinations, to healthcare, to medications, to treatment. We need to integrate social support. We need to do more community academic partnerships, engaging local organizations, leaders, and residents in the community in the planning, implementation, and evaluation of interventions to ensure relevance and sustainability. We need to continuously give feedback and adapt the strategy. So it's like there's something in medicine we call a quality improvement process. Go back and see, did we do it right? No, let's see, what do we tweak? And not be afraid of saying, I didn't know we made a mistake. Let's continue. And then collect and use disaggregated data to identify disparities, inform interventions, and advocate. And when I say disaggregated, it means that we have the data, we know the communities, but we don't give out the addresses or the individual data, right? It's like disaggregated, knowing what the percentage are, what the numbers are in each town, in each community, in each county, in each zip code. We need to advocate for policy changes that expand access to preventive services and address systemic inequities. When we talk about systemic inequities, we talk about inequities that are caused by barriers created by the systems. And we know that right now we are in that situation in much bigger way. And we know that these strategies have demonstrated and will continue to demonstrate effectiveness in addressing testing and care. We are currently doing an executive director search to ensure Latin-19 transitions from a volunteer-led structure to a professionally managed organization. So we are in the process of hiring an executive director, thanks to a grant also from the KB Reynolds Charitable Trust. I mentioned earlier, as a Latina, I have felt like I am a horsefly, a tábano. I like the word tábano in Spanish more than the word horsefly in English, but I'm a tábano, right? I'm going, biting, asking until those who need to listen. We've done it during the pandemic and beyond. We want to hold ourselves and others accountable, the data supporting our claims. And my closing message is that equity is a justice issue, that community is at the heart of transformation, and that together we lift as we climb. We need to continue to work together. To contact us, send us an email to hola@latin19.org, and the website is latin19.org. I invite you all to join us at Latin19 at our Wednesday convenings. Thank you so much. I hope I didn't go too fast. I had too many slides for the number of time I had. Thank you.
Thank you, Viviana. That was such great information and data and research and work that Latin19 has been doing for the past couple of years. We're really appreciative for you to show that to everyone here on the call. So we're going to open up for questions or any comments. So I will leave the floor open. You guys are welcome to put in the chat or raise your hand or unmute.
I will be happy to answer any questions.
Yes. I don't know if Juvencio wants to get us started.
Thank you, Marlene, and thank you, Vivian. Nice to see you.
Nice to see you too.
I'm sorry for having my camera off, but I think one of the questions would be, Vivian, what has been the biggest challenge as a new organization in North Carolina with this mission and objectives and this very broad? Because I mean, your framework is very broad and you touch just about any sector that you can think. But with that vision of community driven, I mean, that's what I love, and it's so beautiful. It has this framework of community driven. What has been the biggest challenges for you as a leader of this group?
The biggest challenge, I'd say, is lack of funding, right? It's like, because we're there to listen, we're there to hear, and I have to say that I never expected when we started this in March of 2020 that 5 years later, 5.5 years later, where we continue to meet on Wednesdays and to still have, anywhere between a low day is 27 people, a high day, like in January when we talked about how to respond to new policies, or in February, it was still 100 people coming together, right? And so, so it's an act of love in a way to our community, but lack of funding for an executive director. A lot of us are volunteers for this work. All the work we are doing is volunteer, and so that's one of the issues, right? Making sure that we bring now in the hopes to bring in, and we're not good at fundraising. We're terrible at fundraising, so that's one issue. But this is grounded on the understanding that really is important. It is really important for health systems and members of health systems and health departments to listen to the community one-on-one right there, right? What we hear sometimes is that as people advance and become leaders, sometimes they forget what the community was saying, la base, there's the song that in Argentina sings, huele abajo, porque abajo está la verdad, fly low, because low, where the people are on the ground, is where the truth exists. Eso es algo que los hombres no aprenden jamás. This is something that people never learn. And we need to maintain that learning from the community, because the community is the one that experiencing successes, and the community is the one that experiencing problems, right? And for me, that's key. To hear from the community. Yo tengo el privilegio. I'm a citizen. I am a doctor. I live in a big home. But I need to stay grounded. And I think for many of us, that this is what I think has been a success. Juvencio is to listen directly from the community, and also. Yeah, sorry, I turn your, what is the most difficult to what?
No, that's great. That's great. Thank you, Vivian. Thank you. I think we can see your passion that you have, a passion you bring to this framework. And again, the second question is more around the message that is important to deliver across different sectors, but especially community-based organizations that they not engage with community research like you do. And I don't know if it is because of lack of knowledge, what the greatest benefits community research really brings to community-based organizations or the work that they do. What would be your message to those organizations out there that have never been engaged with partners like your organization, but the framework that you bring as an expert around research?
Yeah, I think this is a blind area, a blind spot from health systems, and because of assumed language barriers. And I say assume is because it's not so hard to have proposals that include interpretation and translation, but it's often the issue that happens with research proposals where the Latino community is not included. Oh, there were not enough numbers. Like, no, yeah, of course there were not enough numbers to make it relevant to your research results, is because you didn't include them, because you didn't go outside of your regular square of system to go involve the community, right? I'm very proud that New Health now has the webpage all in Spanish. We work really hard to get that translated. It's completely translated, and it wasn't by Google Translate. It was by real people. And at the same time, there still continue to be barriers, right? But we need to work. We as community-based organizations, and that was one of the other difficulties, is to make sure that in our role as Latin-19, we don't cannibalize, we don't take away grants that are important for other community-based organizations. We just want to make sure that we can be in this space of being able to influence health systems, and because health equity is so important. So I hope I answered some of the question.
Yes, thank you, Vivian. Appreciate it. Thank you so much.
Si Carolina Siliceo tiene una pregunta.
Sí, thank you so much for such a wonderful presentation. Apologies, I'm driving, but I just wanted to ask, because when I hear the vision and mission of Latin-19, I see so many parallels with the Office of Minority Health and Health Disparities and the history there of using trusted messengers. There's case studies from COVID that really show the impact and the effectiveness of the community health workers. What recommendations do you have? I 100%, understand the Tabano effect, like continuing to push, but even within systems right now, we're seeing how the federal government is imposing such challenging policies and restrictions. And I think at large, the non-Latinx community in North Carolina still doesn't understand who we are, what we need, who's here. When we look at numbers, yes, Medicaid expansion is going to greatly impact maybe 600,000 North Carolinians, but equally so, maybe 500,000 Latinos in North Carolina will be impacted by other policies that are just going to completely make accessing care really complicated. But we never really look at those numbers because maybe the data is not there. What encouragement or suggestions, recommendations do you have on that end?
Yeah, the dialogue and the conversation. This is what I think has made Latin 19 so effective, because those Wednesdays I knew bring together people from all different sectors that normally weren't together, eliminating the silo systems, the conversations that occur in a silo, and making horizontal dialogue so that everybody from this silo is hearing what other groups are saying. As you mentioned, some of the federal policies are very difficult for our communities. For me, as the healthcare provider, I know patients are going to suffer significantly from losing access to health insurance. And at the same time, is that just because currently the policies are not there to support this work, in spite of a lot of pushback from multi-sectors, I think it's important that we continue to understand and hold our communities close to our hearts, because the work that we are doing, it's non-partisan. If you think about health, good health is good for everybody, no matter where you come from, where you belong, what party you're from. Health workers that are, workers that are healthy, improve the bottom line of companies, right? Like so really understanding this from that perspective, right? And maintaining the dialogues and maintaining the pressure. What may not work right now, or what might have not worked in prior years, may work next month, right? So it's continuously becoming educated about these issues and continuing to drive the change. And a veces it's un pasito adelante y 10 para atrás, right? Sometimes it's one, but we need to continue. And I know we're out of time, and I would love to continue this conversation, but please join us at the Latin 19 meetings on Wednesdays at noon. We do multiple different topics, and we also do listening sessions. If you go to our website, the latin19.org website, it's a little bit outdated, again, because it's volunteer-led. We have trouble maintaining it. But please sign up for our weekly newsletter, attend the Wednesday gatherings, and learn and teach us, right? It's working together. Thank you.
Thank you so much, Dr. Viviana. We did go over time, but we do appreciate it. We'll be sharing this information with everyone as well, including the links so that they can get the news. I get the newsletters and I enjoy them every week. So yes, I'll be happy to share that. And thank you again for joining us. So I will end the meeting now. If you guys have any questions that you can think of later on, please feel free to reach out to us in our email. I'll put that in the chat box one more time. But other than that, I hope everyone has a great week, and thank you again, everyone. Bye.
Yes, ciao.
Thank you. Bye.